I left this morning on my way to work at about 6:30 and got home tonight at about 7:30. And normally she's at the back door chomping at the bit to get inside, and found it a bit odd that she wasn't there. So I went around the back and I found her doing this.
I wouldn't believe you'd actually need that muzzle.
Oh yeah.
Zena's owner is out of town, but his flatmate Gareth has rushed in with the trembling Rottie.
She really is displaying the classical signs of a snailbait poisoning, and you do have to act pretty quickly on these guys because as you can see, their system just goes into overload. Come on, girl, it's all right. You just keep calm there. You're being very good. If it gets too far, they can actually go into seizures. And when that happens, it's very bad news. You've had some problems with neighbours, you suspect, before?
Yeah. And it's generally when she's kept outside and she might bark a bit, and I think they're a bit pissed and they try a bit of... I'm assuming last time that she was poisoned.
A phone hook up to the owner confirms the suspicion of poisoning.
To me, it looks as though she's actually had something like a snail bait.
Yeah.
So what I'm going to do right now is give her an injection of something called atropine, which is going to hopefully reverse a lot of those effects.
Yeah.
That's all right with you?
Do whatever you got to do.
Yeah, all right, no worries, mate. This one's a pleasant injection. The next ones won't be so pleasant. So if you just...
3-year-old Zena the Rottie has been rushed into the Bondi clinic. Chris suspects she's been poisoned. He administers atropine, an antidote.
The next thing I'm going to do is actually make her vomit. I want to get that stuff out of her stomach so she stops absorbing it, but I'm just trying to prevent her going into a seizure right now. This is what looks quite bizarre, but essentially it's a tablet that we're going to inject. Once this kicks in, she'll want to vomit. Now, that should be enough. I'll get this off. This is going to be a really tough moment for her because she's already feeling incredibly bad. Come on, girl. Perfect, here we go. Come on, girl. Yeah, it does stink, doesn't it? You're in charge of that.
Oh, great.
Lucky you. Can you pass me that tape as well?
Zena's vomit is green. Chris now realises she's swallowed snail bait containing a deadly poison called metaldehyde. There's no antidote for that.
It's a little bit funny that the guy who owns the dog is a cop, and so is a housemate, and so are all these guys here.
Is this dog being poisoned? The person that poisoned it doesn't know what he's messing with, does he?
He's in a bit of trouble.
The intravenous route just doesn't seem to be responding to that, and that's probably a result of the poisoning itself. What I'm actually going to do here looks a little bit strange, but it works. There's a great blood supply to the eye, and that gets absorbed pretty quickly. Yep. It's a bit of an irritant though, so she won't like this.
Paul, Zena's owner, is now racing back to Bondi to be by her side.
Once you get to know her, she's the most beautiful, friendly, lovely-natured dog. She's an absolute... She thinks she's human. She's a baby.
Yeah, Paul?
Yeah, mate.
Hey, mate. What I'm proposing is that we take her over to the emergency centre for the simple fact she's going to probably need to be anaesthetised and also monitored throughout the night. And she also needs something called a gastric lavage.
Zena needs her stomach pumped urgently to purge the toxin from her system.
I'm assuming she's actually been given a fair-sized bait there. So just pull it in. At the moment, it's touch and go.
The seriously ill Rottweiler now needs to be transferred to the clinic's emergency referral hospital, SASH.
Chuck a blanket on or something? Or...
Yeah, we'll do that in here. She's warm enough, though. It's all right.
Zena is in a critical condition.
How you going? You've got Zena. Just to fill you in, Lisa. She came in about an hour and a half ago, and she was tremoring and basically in a fair bit of distress.
So just putting both tubes in. We're trying to fill up the stomach with warm water and then basically empty it out. So trying to physically remove all of the toxin from her stomach.
The thing I'm most mindful of at the moment is the potential for brain damage. We saw Zena's temperature shoot through the roof to above 40 degrees. Now, if it goes over 41 or, heaven forbid, 42, then there's a very real risk of brain damage.
The gastric tube has been removed and now the vets can only wait and hope.
What we're looking for over the next few hours is basically a reduction in the amount of tremoring she has. We want her whole nervous system to calm down.
The devastated owner finally arrives.
We just say that we are doing everything we can.
Paul is a Sydney policeman and he's certain this has been an act of pure malice.
If they've got a beef with me, they've got a beef with something. But to kill a dog, to try to kill a dog, which they would have done if we weren't home. It makes me angry. I don't know what. I've got to be the lowest of lows.
So the next few hours pretty much decide Xena's future. If she can metabolise the toxin that's in her system, keep that temperature down, and begin to show some significant signs of improvement, then the future looks good. If not, if she continues to tremor, if she goes into seizure, then it's bad news. It's very bad news.
How are you, Lisa?
Good, how are you?
Good, thank you.
You must be
Better.
happy.
A lot better.
Yeah, come see her. You'll be over the moon.
At the emergency hospital, Xena has made it through the night.
Oh, yeah, look at you wearing your
That
tail.
tail's going. So she'll still be quite groggy today and even probably into tomorrow.
It's been a close call. Xena could have suffered severe brain damage, but remarkably, she's okay.
And she looks so normal now.
Yeah.
And to see her lying there last night broke my heart. And but to see her again today, complete turnaround. I can't describe it. Ecstatic, relieved. Don't be all camera shy now. You always want to be the centre of attention.
Back at home, Xena is showing no signs of her snail bait ordeal.
I'm ecstatic that she's here now, and it looks like we'll be moving out soon. I just can't take the risk that something like this is going to happen again. But I'm so happy that she's here now.
Just.
Yeah.
A huge Bernese Mountain Dog has been rushed into the Bondi Referral Hospital, SASH. 2-year-old Chili suddenly collapsed with an extremely high temperature.
I'm suspected of a tick or a snake because a few hours ago he was fine and leave him for a couple of hours and he's gone downhill very quickly. Usually he comes running out of the gates to be fed and he just sort of stumbled out and then laid on the floor and wouldn't move. Very alarmed.
What's going on?
So, this is Chili.
Yep.
Chili hasn't been able to walk for about an hour and a half.
This dog is massive. He looks like a big bear on the table and it just looks so sad.
Hey, Chili. Pretty flat, aren't you? Let's just collect some blood so that we can check if it's a snake bite straight away and we'll go from there. You're a good boy, hey?
Chili's in a really bad way. He is so lethargic, he's weak, he doesn't want to wake up, his temperature is dangerously high. I mean, Michael thinks it could be a snake bite, but there's a whole lot of other things that could cause the same signs. I just hope the blood tests give us some more answers.
Michael has only had Chili for 4 months.
He's just special. Part of my breeding program, but he's a really nice show dog as well.
The Bernese Mountain Dog was named in honour of the country he was bred in. It cost Michael $15,000 to bring the prize dog from South America to Australia.
He's lovely to have at home, so yeah, he does mean a lot. They all mean a lot, actually.
Good boy, Chili. It's okay. He's a very sick dog right now, so we've got to do a whole lot of diagnostic tests to try and work out what's happening. You're a good boy, Chili.
2-year-old Chili has been rushed to SASH after suddenly collapsing at home. Owner Michael is worried his prized Bernese Mountain Dog has been bitten by a snake.
So we've done a couple of blood tests on Chili, one to check level of his muscle enzyme and the other one to check his blood clotting times, and both of them are normal. So the next step is to do a venom detection test to see if there's any sign of the venom circulating through his body.
So, negative.
Negative, yeah.
Yep. All right, well, at least we've ruled that out. Good boy. Yes, you are. Chili's got a really high fever. It could be anything. It could be an infection. It could be inflammation. It could be cancer.
Good boy. Slide.
Lisa's hoping X-rays of the chest and abdomen will provide clues to what's causing Chili's dangerously high temperature.
Good boy, Chili. It's okay. They all look pretty normal, so the problem is we still don't know what's causing Chili's signs. We've got the really sick dog and no answers yet.
Good boy. Good man. Good.
So we're going to do an ultrasound of Chili's abdomen next, and I really, really, really hope that we're not finding cancer in there.
Good man. You'll be all right, mate. Come through.
Before the ultrasound, Lisa needs to break the news to Michael.
Being a Bernese Mountain Dog, they are prone to certain cancers at a young age, as you know, so we cannot ignore that. I can't make any guarantees, okay?
Just do your best.
All right.
Just want him back, want him better, and quite possibly it could be something big. So, yeah, it's a lot to think about.
Little scan?
I feel so sorry for Chili. He's just a big, gentle giant and he's feeling really, really sick. I want to be able to help him, so I'm just going to have to run test after test to try and find an answer.
At SASH, 2-year-old Chili's ultrasound is underway.
Chili's a good boy.
The massive Bernese Mountain Dog collapsed suddenly and has a dangerously high fever.
Well, these are the lymph nodes that are enlarged.
So he's got like a focal area of inflammation in his bowel.
Yeah, he does.
We're looking at all the organs and then we get to a loop of bowel that looks really abnormal. We need to really monitor this area very closely because if it gets any worse, we have to send Chili straight to surgery. You're a good boy, Chili. Okay, darling.
Chili will have repeat scans in a few hours.
You're a good boy. Yes, you are.
If he doesn't show any improvement, exploratory surgery will be the next step.
Have a good rest. We don't know what's causing it. It could be a local infection, it could be local inflammation, it could be an obstruction, and it still could be cancer. All right, darling. Hey, Chili. Hey, buddy. How are you feeling? How are you feeling? Come out. Out you come. Feel any better?
For Chili, it's time to find out whether he needs to go under the knife.
Feel any better? Not telling me, huh?
It's been 12 hours since the Bernese Mountain Dog was brought into SASH after suddenly collapsing at home.
We really have to repeat that ultrasound just to make sure that there's no worsening and that that area looks better, because if it doesn't, this big guy's going to be having surgery. Such a good dog, lying so still, huh?
Okay, Lisa, we're looking at the same area and we've still got some change I'm really unhappy with. There's a lot of inflammation. He's going to need surgery.
Oh, damn it.
Specialist surgeon Andrew Marchevsky will be in charge of the exploratory surgery. But he's already worried about the cause of Chili's dramatic fever.
He could have cancer. I know he's 2, but unfortunately the Bernese can get a really nasty disease called histiocytosis. It can get him at any age and it can kill him at any age. We're just going to look for anything abnormal and then take a sample of it if we find it or cut it out if it needs cutting out. It doesn't look very normal at all. His lymph nodes are huge. The lymph nodes are enlarged in response to an abnormality, and it can be gastroenteritis, can be cancer.
The samples will now be sent away for analysis.
Now we've got to wait for him to come through the anaesthesia and recover in the surgery, and then we have to wait for the biopsies, both culture that we've sent away, look for bacteria, and then the actual tissue and see what we're dealing with. It's not over yet. We just have to wait.
Hey, you look so much better, don't you?
It's been 2 days since Chili had exploratory surgery to investigate a mystery inflammation.
Your tummy feels good.
Lisa is still waiting for lab results before she can rule out the possibility of cancer.
When Chili came in, I felt so sorry for him. Those big brown eyes, just feeling so lethargic. Within a few days, having the surgery and being treated with the drip and antibiotics, he's really picked up. He's doing a lot better. But we still don't know what's wrong with him. We don't have a diagnosis, and we won't know anything until we get those results from the lab. So we're all quite anxious to get them, Michael included.
You want to go home to Dad? You want to go home?
It's a bit nerve-wracking. I'm hoping it's nothing major. Can't wait to see him. I've only had him for, about 4 months, 5 months, and he's already got a piece of my heart.
Who's there? Hello.
Seeing him here with Michael, climbing all over him, hugging him with his giant paws around his neck was amazing. What a transformation. He loves his dad.
No, I love him. Let's go home. Go home? Yeah.
Oh, this must be it. Oh, look at them.
2 weeks later, Lisa's on the road to deliver Chili's test results.
Come here, Chili. Hi, Chili. You're so good. You're showing off that you're better. The good news is it was just an infection.
Just an infection, yeah. After all that,
Some antibiotics and he's going to be on the road to recovery.
Yeah.
Michael can finally stop worrying about that cancer scare.
I'm really happy with the results.
Chili.
One of my dogs that I really love so much, and yeah, he loves me as well.
You're a big boy. Nearly my height. You are. I love cuddles. I love it. Hey? Oh, big boy.
He looks fantastic. He looks $1 million. And it's so nice for me to get out of the hospital and come and see Chili in his own environment. It's pretty special.
So these are the babies.
Oh, my goodness.
Before Lisa leaves, Michael introduces her to the next generation of Chilis.
They're 3 weeks old.
Look at that.
I didn't know that I was going to be meeting Chili's puppies, and it was incredible to see these tiny little babies all over the place.
Oh, they're delicious. This is pretty amazing. Hey? Chili's babies.
Thank you for coming up.
My pleasure. If I don't leave now, I could be taking one, so I gotta
Arrange
get
that, that's okay. See you later, Lisa.
Bye,
Say
Chili
goodbye.
boy. Bye, Chili boy. You're beautiful. See you.
At a local beach, Evo is taking his prize Great Dane Rufus and his 6-month-old son Jurgel for their daily swim. But today, something is wrong.
He's had a high fever and he's very weak, very, very weak. And he's off balance. We'll see what the vets have to say. Fingers crossed.
Evo and Rufus arrived to see Chris. The big fear is that Rufus has contracted meningitis, a potentially fatal inflammation of the brain's lining.
Okay, so what we've got is a very, very inflamed and red ear canal. And we push down deeper. You can see as we go deeper, the pain does increase.
Looking at it, it's a real mess. It was red, it was inflamed. We've got a lot of black wax in there, and black wax worries me because it's a sign of infection.
There's no doubt Rufus has a debilitating ear infection. But has he come to Chris in time to stop the bacteria spreading?
If they hit the brain, you've got serious problems with diseases like meningitis that can kill him.
Chris is testing Great Dane Rufus for signs of meningitis, a deadly inflammation of the brain.
One of the tests for meningitis is, and this looks very strange, is to actually do that. And because meningitis is an inflammation of the meninges, which is the layer of cells that wraps the brain up, doing that hurts like hell. And for him to be able to put up with that, despite it being quite a crude test, is telling me that he doesn't have meningitis. This can develop into meningitis though, make no mistake, that can happen. But we're not there yet, and my goal right now is to prevent that from happening. You're probably wondering why these haven't worked? Yep.
Evo attempted to treat Rufus's ear infection with human drugs.
Human antibiotics are a big no-no for two main reasons. First of all, the dog could be allergic to them and have an allergic reaction that could even kill it. So in trying to help it, you could actually do quite the opposite. But secondly, the dose of human antibiotics, how do you know how much is the right amount? Because what a human needs is often very different to what an animal needs. He doesn't flinch, does he?
No, he's amazing.
With the right medication for Rufus, his ear infection will soon be under control.
Can make him much better. Yes, it is. It's excellent news. Yep. I'm very, very relieved. Hopefully we should see improvement within the next 48 hours. So that's great.
In Melbourne, Karen and son Xavier are arriving at the Kingston vet practice with their Labradoodle Molly and new addition to the family, St Bernard Crunch.
Good boy, Crunch.
Molly's a clinic regular, but this will be the first time Dr Danny Dusek is meeting big, lovable 4-year-old Crunch.
Hello, this must be Crunchy Boy.
We've had Crunch for about 2 months now, and yeah, they've been a very exciting 2 months. I love them so much.
Oh, you snobs, aren't you, eh? Oh, you're beautiful. He got your arm.
He does that a lot.
Crunch has just covered me with his slobber love, but there's certainly a lot worse I have to deal with, so that's okay. All right, well, we might pop Crunch on the scales and see what he weighs in at today, eh? That's a boy.
Onto the scales.
Up you pop.
Good boy.
Well done. Oh my goodness. So we're I'm gonna say 69 kilos, you big boy, hey? Don't think I'll be picking Crunch up onto the table today. Yeah, I think we'll leave him on the floor. You're just a big teddy bear, aren't you?
Crunch came to us from another family who had had him from a pup, but then they had returned to full-time work after having a young child and felt they couldn't give him the attention that he needed. So, yeah, we're very lucky to be the ones who could rehouse him.
Crunch has come to the clinic to see Danny for his yearly vaccination, and Molly has come along to keep him company.
All right, Crunch and Molly, come on through. Molly girl, you're such a sweetheart. All right, we're gonna try sit you up, okay, mate? Hey? Get under that chest of yours. Up your pop, mate. Up your pop.
As it's Crunch's first visit to the clinic, Danny begins with a physical examination.
Let's have a little look at you now, all right, mate? Now let's have a little look at these beautiful ears now. They don't look too bad. Now I'm just gonna have a feel of this leg. Yeah, well done. Oh, you don't mind about that. Have you noticed any limping or lameness at all?
No.
No? That's good. I'm just having a look at Crunch's elbows and hips. They're really important, particularly in your large and giant breeds because of hip and elbow dysplasia, and St Bernards do tend to be a bit more overrepresented as far as those disease processes go. It's possible that he could have a bit of mild discomfort going on in his hips that we're not seeing when he's exercised.
Yeah.
But just keep an eye on it for now.
Sure.
Alrighty, let's have a little listen to your ticker, hey? St Bernards can get heart disease. But Crunch's heart sounds beautiful. We've got no evidence of any murmur or arrhythmia, which is really good. We might do those vaccinations now. So we've got an oral component first and then go for the injection afterwards. Try not to eat my hand while we're there, all right, mate? So I'm just gonna squirt that into your gob. That's away. Oh, very good.
Good boy, Crunch.
Mightn't taste the best, I'm sorry.
With the oral vaccination done, Crunch now needs 3 injections.
All right, let's give some treats. Treats are the best distraction. If you want to be in charge of the treat giving up the front just while I'm giving that, and then he won't even notice.
More treats.
Good boy. The heartworm injection for Crunch is particularly big, so this one might be a little bit more ouchy than the first. Oh, I know, I'm sorry. All right, one last time. Oh, mate, oh, you really cottoned onto that last one, didn't you, hey? I'm so sorry. I think Crunch has landed on his feet with you guys. I think he's going to have a really beautiful home, so...
Thank you.
It's a really generous thing to take on such a big dog. See you, Crunchy boy, you'll be good now. At 4 years of age, to give him such a loving home like they have, they're just really kind-hearted people.
We'll see you the same time next year.
Will do. See you later. All the best,
thanks
guys.
a lot. Bye. Hey, guys. Hello. Hello. Hi, guys. Hi, guys. How are you? Hello, Ed.
I've known these two since they were just little babies, and believe it or not, once upon a time, Eddie was about so big. When Jeannie and Eddie come to visit, it's standing room only. They take up the entire reception.
Wow.
I know I love you too. Oh my goodness.
They're my life basically, so everything that I do, they do, or everything that we do as a family, they do, and they love swimming, they love going to the beach, they love riding around in the back of my ute. Pretty much they're involved in every single thing that happens.
Jeannie and Eddie's combined weight is 130 kilos. I'm just dealing with one of them, and I think that's going to be enough for me. Hey Eddie, are you going to come with me?
You be a good boy, huh? Huh? You be a good boy. Hmm?
Oh my goodness.
I
Look
know.
at these guys. So
Huge.
beautiful. So,
58 kilos.
58 kilos
Yep.
of love. A beautiful love.
Kate's been closely monitoring an umbilical hernia that Eddie's had since he was a pup.
I thought it was going to heal by around about 6 months, but it hasn't closed over, and recently it started to grow.
Eddie, hey, be a good boy. Be a good boy, won't you? Huh?
Okay, come on, let's go. Come on. Oh, come on, this way, this way. Come on. Eds. Good boy. Come on, this way. Come on, Eddie. Come on, Eddie. Up you go, darling. There you go. We do need to repair this hernia. The risk is that a piece of intestine may protrude through that body wall defect, becoming entrapped, and that may be fatal for Eddie.
It's okay, you're okay. You're a good boy, don't worry. Okay.
This is actually our induction agent, so this is actually putting him to sleep.
Super sleepy.
Good boy.
Super sleepy.
Good boy.
Super sleepy.
Dropping,
dropping,
dropping.
dropping.
Good boy, Ed.
With Eddie now fast asleep, Kate and vet nurse Elizabeth are going to have to use all their muscle power to get him up onto the table.
He's very heavy. It's one heavy dog.
Onto his side.
Eddie's having a little bit of liposuction today. He's having the fat removed so that we can actually get to that little abdominal hernia and close it up.
The hole in Eddie's abdominal wall was only tiny when he was a pup, but as he's grown, it's expanded, and more of his intestine is pushing through.
So this hole goes all the way down. Blunt dissecting some of this fat away. So all of these adhesions are just stuck to the outside. That's because it's been there for so long. What's happened is stuff has come out of the hole, and then essentially it's now adhered to the skin on the outside. So you can see this little hole here, and we're going to stitch that up. We stitched up this little hernia, right? So you can see the body wall there is nice and it's not got a hole in it anymore, which is great. And nothing's gonna fall out. So you won't even notice. He's gonna look like he had a regular belly button. Oh, hello. Very tired.
Eddie will be left to sleep off the anaesthetic before heading home in a few hours.
Night night, Eds. How are you? Are you good?
In Bondi,
Do you want to go home? I think it might be time for you to go.
bird whisperer Kate is back to more routine veterinary work with Eddie ready to go home.
Who are we going to see? Can you hear that? Who is it? Eddie. Do you be more excited to see you or me?
Both. The $1 million question, are they going to be able to keep Eddie quiet for the next couple of days? Good luck with that.
Hello, boy. Come here.
Graham and daughter Ruby are excited to see their big boy.
Give me a big squeezy cuddle. Oh, that's a good girl.
I've got some pain medication for you guys to go home with to
Yep.
start tonight. So you're going to give that with food tonight. So there will be some swelling at the site,
Yep.
right? So it's been stitched in quite a few layers. He's going to be a little bit groggy tonight.
Yep.
I'm not going to send him home with a cone on his head, but
Okay.
if he licks at that or
Yeah.
he has a go at that, then you need to come back and get a cone for him.
Oh dear.
No cone of shame just yet.
Are you a good boy?
Good boy, mate.
Are you a good boy? Yes.
See you guys.
See you
look after
later.
him.
Thank you. Thanks for looking after him.
Bye, Ruby.
Come on, Ed, let's
Bye,
go.
Eddie. Bye, guys.
Hey. Way. Good boy.